Welcome to Angel Health Academy. Topic for the day is use of basic epidemiologic tools to make community diagnosis. So topic for the day or for the session is use of basic epidemiologic tools to make community diagnosis. Let us see what are the different basic epidemiological tools used to make community diagnosis and prevent and control various community problems after diagnosis. So using basic epidemiological tools to make a community diagnosis or using the epidemiological tools in community diagnosis is very essential for effective public health planning and intervention. So whenever we make public health planning and interventions to prevent or control various problems, so we have to use the basic epidemiological tools. Okay, so usually this tool is related to community diagnosis. That means without using the different epidemiological tools or basic epidemiological tools, we cannot make a proper community diagnosis. We cannot render effective public health planning and implementation or various interventions. So with the help of these basic epidemiological tools, the public health professionals, public health care personnel, healthcare team members can accurately, properly diagnose all the health status of a community. So health problems of or health events of a community. Then they can identify the priorities required in the community, and after that they can plan effective interventions to improve the health outcomes or total health of that particular community. Thus health personnel can render effective public health services. Now let us see what is community diagnosis. Community diagnosis is a comprehensive process. So it is a big process. This is a systematic steps. So it is a comprehensive. It includes all the areas of development. Okay, comprehensive process or assessment. It is a comprehensive assessment that identifies the health status of the people in a community, health needs of the various needs, general and specific needs of the community people, and various resources available in that community. So community diagnosis is a comprehensive process or assessment that determines, that identifies, that helps to find out the health status of the members in the particular community or the needs of the people in the community and the available resources, man, money, material in the community. This process, that is comprehensive process, that is community diagnosis, which involves systematically collecting and analyzing the data. Through community diagnosis, we collect the data. That is systematically we collect the data. Scientifically, we collect the data. And after collection data, we analyze the data to determine, to find out, to understand the primary health care problems of the community and various issues of the community that is affecting a community. Then after finding out these problems and issues, we can go for, or this will guide in planning and implementing various interventions in the community to promote the health of the community. Thus, community diagnosis is a comprehensive process or assessment that identifies the health status, needs and resources of the community, and this process, that is community diagnosis, involves systematically collecting and analyzing the data or information to determine or understand the primary health problems of the people and issues of the people or issues affecting that community or community people, which then later it helps to, this information or that data will help to guide various planning and interventions in the community to promote the health of the people in the community. That is about community diagnosis. Now the topic for the day is basic epidemiological tools used in a community diagnosis. So to make community diagnosis, we have to use many epidemiological tools. Okay, so let us discuss in detail about basic epidemiological tools used in community diagnosis. So community diagnosis is made by these 8 different steps. Okay, in all these steps we use different basic tools. So basic tools used in community diagnosis related to these steps. Okay, these activities or measures all comes under to make an effective community diagnosis in a community. For that we use different type of tools, that is basic epidemiological tools. That will be explained in detail when I explain one by one of these components. So the tools belongs to community diagnosis includes in descriptive epidemiology, analytical epidemiology, screening and diagnostic test of various infections or outbreak in the community, outbreak investigations. Fifth one is surveillance system. Sixth one is community health assessment. Seventh one is risk assessment and communication about the risk to the community, that is risk assessment and communication and others. So these are the basic steps for community diagnosis. During these steps we apply many epidemiological tools that will be discussed with these 8 components. So descriptive epidemiology, analytical epidemiology, screening and diagnostic test, outbreak investigation, surveillance system, community health assessment, risk assessment and communication. Let us discuss one by one and let us understand the various tools used in these different steps of community diagnosis. First one is descriptive epidemiology. So purpose of descriptive epidemiology in the community or in community diagnosis is to describe the distribution of health events or health problems or the disease in relation to the time, place and persons. So descriptive study, as you know that in this we make a description of a particular epidemic or infectious diseases in the community. Okay, in relation to the time of occurrence, the place of occurrence of that particular epidemic and who are the people are affected with that epidemic. So to describe the distribution of health events or health problems or epidemic by time, place and persons. So in this descriptive epidemiology we use 3 types of tools mainly, that is survey and surveillance system. So first tool is surveys and surveillance system. So making surveys. So without survey we cannot get the data related to or description about the epidemic. So surveys and surveillance system, epidemiological maps, preparing epidemiological maps or mapping software also available, that is mapping software, then graph and tables to explain the description of that particular problem or epidemic in relation to time, place and person. So these are the 3 important tools used for descriptive epidemiology to make a community diagnosis. First one is survey and surveillance system. So survey and surveillance system is conducting survey to collect the data on the incidence and prevalence of the disease during descriptive study. So in descriptive study we will find out the incidence. Incidence means newly occurrence cases. Prevalence means new plus old cases. The total cases in the total problems of that particular community. So surveys and surveillance system tool is used to collect the data to find out the incidence and the prevalence of various diseases or epidemic in the community. Second is epidemiological map. The second tool is epidemiological maps or mapping software. So this map or mapping software is used or it is shows the geographic distribution of the health event or health problems or an epidemic. Then it also helps to identify the clusters. Okay, clusters means a group of cases in particular locality. Okay, thus epidemiological map as a tool or mapping software helps to show or it manifests the geographic distribution of a particular disease or epidemic when it is used in descriptive study, and it also helps to identify the cluster of cases in a particular locality in the community. Then the third tool is graphs and tables. So in this our study, when we describe, we use different graphs and tables as a tools, okay, in descriptive epidemiology. So this helps or this visualize the trends, the changes, okay, take place over the time in the community, and it helps to compare the different subgroups that we have studied in the descriptive study. So thus graphs and tables helps to visualize the trends over the time, that is changes of incidence, changes of number of cases of a particular disease in the community. So that is the trends over time, and it helps to compare the incidence and prevalence incidence with the other incidence, etc. That is compare the subgroups. Thus, there are 3 important tools used in descriptive epidemiology. That is, one is surveys and surveillance system, epidemiological maps and mapping software, and graphs and tables. Next is application of these tools. So, in the descriptive study, these tools are used to identify the patterns of diseases and patterns of health in the community, okay, and to identify the high risk group in the community. So these tools helps in descriptive study to identify the different pattern of occurrence of a disease and health status of the people, and it also helps to find out the or identify the high risk group or people in the community. So the second step of community diagnosis, we make a further study, that is second study is analytical epidemiology. Okay. So here we find out the association between the variables. So the purpose of analytical epidemiology in community diagnosis is to investigate the causes and association of health problems or health event or diseases and exposure, and that is the association between the exposure and outcome of a disease. So there are many factors will be influence some diseases. That factor comes under exposure. If the person is already exposed to a particular risk factor, then we will find out the relationship, whether that risk factor is related to or have an association to that particular health problem or epidemic. So that is the purpose of making analytical epidemiology. So the tools used in analytical epidemiology, we have different types of study in analytical epidemiology, such as case control studies, cohort studies, cross-sectional studies. Okay, all these studies we use statistical analysis software to find out the association between the cause and problem of the disease, or between the exposure and outcome. So the relationship have to be find out in analytical epidemiology. For that we use a tool that is called statistical analysis software. So first one is case control studies. As I already discussed, so in this study we compare the individual with the disease, that is a case. Okay, we call that a case, to those without the disease. Okay, that is we called control. Okay, so we compare the cases and controls to identify any risk factors, or that problem is occurred with any risk factors. For that we will conduct a study called case control studies. So that is a epidemiological tool used in analytical study to compare the case and control and to identify the exposure or risk factors of the cases and association of the risk factors of the cases. Second is cohort study. So here we follow a group of people over a time. Okay, there is a forward looking study for a long period or over a time to see who develop the disease. Okay, whether exposed people or non-exposed people will develop, and how many of those people in the study develop the disease. That is cohort studies. Then cross-sectional studies. Here we examine data at a single point in time to find out the association between the risk factors and diseases or health outcome of a group. That is called cross-sectional studies. So we collect the data only in a single point of time. That is a specialty of the cross-sectional studies. So that is the third tool. Fourth tool is statistical analysis software. For analyzing the data from case control study, cohort study, and all, we use this tool that is called the statistical analysis software, because we want to find out the association or relationship between the factor and health outcome or factor and disease. Then application of these tools. Okay, these tools of analytical studies help to determine the potential causes of the particular problem or disease and the risk factors of the particular health problems. So with this study we will get the association of the cause and risk factors with the particular disease or health problems. So it will determine the potential causes and risk factors of health problem, and we can also find out what is the strength of association in application of this particular tools of analytical study. Third important step in community diagnosis is using various screening and diagnostic tests. So of course we use screening test and diagnostic test to identify the cases. So purpose of screening and diagnostic test in community diagnosis is to detect the disease early in asymptomatic populations. So sometimes a person or client may not show the symptoms of that particular problem. So we have to find out, because this person may be a carrier or he may be able to transmit or spread this disease to other people. So to detect as early and to make control measures, we use various screening and diagnostic tests in community diagnosis. The tools used in screening and diagnostic test in community diagnosis includes laboratory testing. So various laboratory testings are available. Then sensitivity and specificity test. So that is a different type of test, sensitivity test and specificity test. Then we have predictive values. Okay, so let us discuss what are the meaning of these three tools that is used in screening and diagnostic test. First one is laboratory testing. You know that various testing we do in the laboratory to confirm the diagnosis of that particular epidemic or particular disease or infectious diseases. And of course we have to identify which pathogen or microorganism is involved in that particular disease. For that we do various laboratory tests as a tool. Second is sensitivity and specificity test. So these tests are used to evaluate the performance of the screening test. So there are many screening tests we use in the community, but we have to evaluate the quality of that screening test. Then only we can confirm that whatever is diagnosed will be proper or effective or correct or accurate. So sensitivity and specificity test is used as a tool in the community diagnosis to evaluate the effectiveness or performance of the various screening tests. The last one is predictive value. The third tool is predictive value. Predictive value is as a tool, it helps to understand the likelihood that a positive or negative test result is accurate. So after laboratory test, the result may be positive or negative. But that we have to prove. If it is positive or if it is negative, we have to make sure that it is 100% correct this test. For that we use predictive value tools. So thus this tool is determine the likelihood of that a positive or negative laboratory test result is accurate. So we can, after checking this, cross-checking the result of a laboratory test with predictive values, we can make sure that this is accurate and effective. Then like that we can confirm about the case in that particular epidemic disease. Then application of these tools in epidemiology or in community diagnosis, that is to implement the screening program for early detection and treatment. So it is one of the important steps in prevention and control of the infectious diseases or outbreak in the community, that is early detection and treatment. For that we use the three important tools, that is laboratory testing, sensitivity and specificity test, and predictive value tools. Next is outbreak investigations. So as a community diagnosis, that is another step we use whenever there is an outbreak. We have, as early as possible, we investigate the outbreak and we confirm the outbreak, then we verify the case. So outbreak investigations. The purpose of these steps in a community diagnosis to control and prevent the outbreak in a community as early as possible. That is called outbreak investigation. The tools used in outbreak investigation include epidemic curves, line list, hypothesis generation and testing tools. Hypothesis generation and testing tools. So let us discuss about these three tools comes under outbreak investigations in community diagnosis in the community. First one is epidemic curves. The first tool is epidemic curve. So epidemic curves helps to visualize the onset and spread of cases over time of a particular epidemic. So we can understand that with this epidemic curve, we make a curve according to the onset or incidence of a particular disease. So we will get the time of that particular epidemic when it is occurred, when it is spread from one person to other person. So sometimes when we make a curve, it starts from January, then we'll get February, then we'll get March, like that. Sometimes we'll get the same month of every year in the curve. That indicates this epidemic comes in this particular month. So it helps to visualize the onset and spread of a case or epidemic over time. Then second tool is line list. So detailed data about the cases will be there in the line list to find out the common exposure. So in the line list we mention all the cases, data of the cases. Okay, that is detailed data about the cases, and with that list we can understand what is the common factor or risk factor or exposure the case is had a particular epidemic. Thus, line list will give a detailed data about the case, and with that we can find out which is the risk factor that a person is affected with to have a particular epidemic. Thus, with the help of the line list, we can find out what is the common exposure of the case for a particular epidemic. So, it gives a detailed data about the case. With that, we can find the common exposure of the particular disease or epidemic. Then last tool is, the third tool is hypothesis generation and testing tool. So of course after the descriptive study, when we understand the occurrence of a disease in person, place and time, we will formulate a hypothesis or generate a hypothesis. So we use this tool to generate the hypothesis. Then later in the analytical study, it would be proved that, okay, it will be tested or checked, okay. So for that also we use hypothesis generation and a testing tool, okay. So this helps to develop and test the theories about the sources and spread of a particular epidemic or particular infectious diseases. So hypothesis generation and testing tool is used to, or it helps to develop the hypothesis and test the hypothesis, that is develop the theories and test the theories about the source of an infectious disease or epidemic and spread. So under outbreak investigation we have three important tools, that is epidemic curves, line list and hypothesis generation and testing. So next is applications. Of course these tools under outbreak investigations, it helps to quickly identifying and controlling the various sources of outbreak. So thus we can control the epidemic, okay. Fifth step is under community diagnosis is surveillance system. So purpose is making continuous monitoring, continuous assessment of the health problems or health events or epidemic in a community. Okay, so surveillance system is nothing but conducting survey. So continuous monitoring or assessment of health events or health problems or health issues. The tools used in surveillance is various survey, that is survey format and questionnaires. So to conduct any survey we need a survey format and questionnaires. Then we have different type of survey as a tool: passive surveillance, active surveillance, sentinel surveillance, etc. So let us discuss about these four tools comes under surveillance system as a tool in epidemiology used in community diagnosis. First one is survey format and questionnaire. This is very simple. We know that to collect the data of any that infectious diseases or outbreak in the community or epidemic in the community, we should know that, or any epidemic survey we need a survey format and questionnaires. So collect the data, it helps to collect the data from affected individual and from the total community. So for data collection we use the survey format and questionnaire tools. Second is passive surveillance. Passive survey is also a survey, but we get the information from the second persons, not direct information collecting. So regular reporting of disease cases by the health facilities, health workers during their community visit or home visit, okay, or field visit, they'll make the early detection of any outbreak in the community. That will be reported in the health center or in the health facilities or in the health sector such as primary health center, sub center, community health center, etc. So that information we collect is called passive surveillance. Okay, so regular reporting of disease cases by the health facilities or health workers in the health sectors or health agency. Second is active surveillance, that is a direct. So here we are involving in the survey and we are finding out the case. So proactive, that means here we are active, we are directly we are conducting the survey and finding out the case of any epidemic in the community. So it is a proactive searches for cases in the community. So this tool is helps to proactive searches of any case of any epidemic in the community. The last one is sentinel surveillance. Next survey is sentinel. So in this sentinel surveillance we are doing the monitoring, continuous assessment of the specific site, locality or specific group of having an incidence or trends, emerging and re-emerging various incidents is called the changing trends. So monitoring specific sites or localities or groups for trends, changes, okay, or different type of occurrence of an epidemic in the community would be identified by a sentinel surveillance. So these are the four important tools used in survey, that is survey format and questionnaires, passive surveillance, active surveillance and sentinel surveillance. Next is application of these tools. So these tools are helps to monitor the disease trends. So monitor the disease trends and evaluate the impact of the intervention. So based on the disease trends we make different measures. So Through this survey only we can evaluate the effectiveness of our interventions and implementation. That is, evaluate the impact of the interventions of services to control and prevent the various epidemic in the community. Okay. Sixth one is community health assessment. So assessing the health status of the community people is called community health assessment. So in community diagnosis we'll make a community health assessment. So purpose of community health assessment is to gather the data, information of general health status of the community people, needs of the community people and resources available in the community. So gathering data on health status, health problems, health issues, needs, general and specific needs of the community people and resources such as man, money, material available in the community. Everything information can be gathered through community health assessment. The tools used in community health assessment are community survey. So we conduct a family health survey or community survey. The second tool is focus group and interviews. Focus groups and interviews. The third one is health indicators. There are many health indicators. We use that indicators to identify the health of the community people, health status and their needs through the indicators. So these are the three tools used in a community health assessment. Let us discuss in short about these three tools comes under community health assessment in community diagnosis. First one is community survey. So collect the data on healthy behavior of the people, healthy practices of the people through survey, community survey or family survey. And to find out the access to care, whether the people are availing or getting the care or services or primary health care. So the access to care and other factors that influence their health or determinants of their health. Everything will be collected through the community survey. Second is focus group and interviews. So we make many interviews of the community people as a tool to gain in-depth insight from the community members through the focus group and interviews about the community need assessment or community assessment, health assessment. So the interviews and meeting is conducted of various community members, okay, or community representatives. So that is comes under focus group and interviews. Then the third tool is health indicators. So we use different standardized measures to assess the health status. Standardized measures such as we have morbidity indicators, mortality indicators, disability indicators, different rate, okay, infant mortality rate, death rate, etc. These all indicators are available. It's considered as a standardized measure to assess the health status of the community people. So health indicators are the indicators that is a standardized measures to assess the health status of the community people. Application of these tools helps to develop the targeted interventions and allocate the resources effectively. So targeted interventions means we are focusing a risk group to provide some measures to prevent the occurrence of the disease in the future or epidemic in the future. So that is a targeted interventions. Thus it helps to develop the targeted interventions in the community and provide the resources as per the need and significance of the particular epidemic in the community or outbreak in the community. So it helps to allocate the resources effectively. Next one is risk assessment and communication. Risk assessment and communication is another step in the community diagnosis. Here we identify the risk people or high risk people in the community. So purpose is to evaluate and communicate the health risk to the community. After identifying, we communicate to the people, those who are risk. Then we'll make them to take some measures, immediate measures. We modify their lifestyle. Thus we prevent the future occurrence of that particular disease. So to evaluate and communicate the health risk to the community. So first we'll evaluate and we will understand and will inform to the community people, that is comes in communication. The tools used is quantitative risk assessment, qualitative risk assessment and risk communication plans. So first one is quantitative risk assessment. So it estimated the size of the health risk, maximum health risk, number of health risk, that is quantitative in nature. Okay, estimate the magnitude of the health risk. Qualitative risk assessment, we will assess the perception and concern about the risk, whether that client is really aware about that, what about his perception about the risk and the concern about the risk. So in qualitative risk assessment, we assess the perception and concern about the people about their risk. Okay, Then we'll make them to understand. We communicate to them what is the seriousness of that risk, what are the changes they have to make. So the third tool is risk communication plans. So we are planning to communicate this risk to the community. It includes develop various strategies. Strategy is nothing but action plan to inform the people or to educate the community about their risk. So make them to understand the seriousness of the risk and educate them to modify their life. So that comes under risk communication plan tool. Then application of these tools in the community, that is which enhance the public awareness. So application of these tools enhance the public awareness. So empowerment of the people. So empower the public or community through this communication. And at the same time we support the community people to use the various health initiatives. So enhance public awareness and support the community for using health initiatives or starting healthy practices to prevent the problem in the future, as they are already risk in particular problem or particular health outcomes. So we protect the risk people in the community and we support the risk people and we inform the risk people about their risk and its seriousness. The next one is other tools used in the epidemiology in community diagnosis. There are many new tools used in epidemiology such as molecular tools, information technology, that includes even health management information systems, then geographic information system, geostatistics, remote sensing, image analysis, etc. are the new tools used in epidemiology in community diagnosis. Even artificial intelligence AI also can be used in epidemiology and other health related services in the community. Now let us summarize the topic. So far we have discussed the different basic epidemiological tools used in community diagnosis. So there are many aspects, there are many components that is comes under community diagnosis. First one is descriptive study, analytical study, screening and diagnostic test, outbreak investigation, surveillance systems, community health assessment, risk assessment and communication, and last eighth one is others. The common tools used under descriptive epidemiology includes surveys and surveillance system, epidemiological maps and mapping software, then graphs and tables. The four important tools used in analytical epidemiology include case control studies, cohort studies, cross-sectional studies, and statistical analysis software. Then three important tools used in screening and diagnostic test includes laboratory testing, sensitivity and specificity test, and predictive values. The three important tools used in outbreak investigation includes epidemic curves, line list, hypothesis generation, and testing. The four important tools used in surveillance system includes survey formats and questionnaires, passive surveillance, active surveillance, and sentinel surveillance. Then three important tools used in community health assessment includes community surveys, focus group and interview, and health indicators. Then three important tools used under risk assessment and communication includes quantitative risk assessment, qualitative risk assessment, and risk communication plans. So these are the important or basic epidemiological tools used in community diagnosis. Now let us conclude the topic. By following all these key steps of investigation and utilizing these basic epidemiological tools to make community diagnosis, the public health officials or health personnel can effectively investigate and control many outbreak or epidemic in the community of communicable diseases, and they can prevent and control as early as possible. So that's about the topic. So thanks for watching. Hope this video really benefits in your studies and exam. If you feel it is really worth, please like, share and subscribe my channel, and stay tuned with Angel Health Academy for the next and important academic video. Thank you.